Hi, I'm Dr. Larson, and I'm here to talk to you about the difference between these and these. Lasers and LED lights. As you can see, I've got our Chi series lasers here. I've got our A-Light series of LED lights here. And I want to tell you the difference between the two, and then we're going to talk about how to use them in clinical practice. The first thing we need to do is talk a little bit about the physics and the properties of light. But it's okay. We're not going to do it in a boring physics lecture kind of a way. There's a couple of concepts, though, we do need to talk about for laser light. We'll start there. First of all, laser light is monochromatic. That simply means it's all the same color. All of the light waves coming out of the laser are exactly at the same wavelength or the same color of light. And secondly, those light waves are what we call coherent. That simply means that all of the light waves are in the same phase together. Because they're monochromatic and coherent, that makes laser light much more powerful. It's very concentrated light, and that's why it has all the great effects that it has. LEDs, on the other hand, the light is what we call divergent. Divergent simply means that the further you get from the target, the more the beam spreads out. And we'll demonstrate that here. If I start here, you can see that when I come up close, I have a very tightly focused beam. The further away I get a larger and larger area covered. When we compare that with the laser light, it doesn't matter if I'm close, if I'm far away, I'm going to get the same size dot. Because the laser light is coherent, the LED light is divergent. All right, the next thing to talk about is power concentration. Because LED light is coherent, it deposits all of its light power over a very small area, that small dot. Now, this LED that I'm holding in my hand only outputs 5 milliwatts of power, but that 5 milliwatts is highly concentrated in a small area. This light, on the other hand, outputs 500 milliwatts of power. There's 100 times more power coming out the tip of this light, but it's over a much larger area, therefore the light is much more diffuse. And that, by the way, is why safety glasses are recommended for use with lasers. When you have that highly concentrated light over a very small area, if it concentrates on a spot on the retina, it can actually damage the retina. Depending on the power of the laser, retinal burns are even common. And so laser safety glasses are always a good recommendation as a safety precaution anytime you're dealing with lasers. But they're not necessary when you're dealing with LEDs because the light is so diffuse that it's not going to do any damage if it's concentrated on the retina. Okay, one other thing to talk about. Both of the A-lights have 3 power levels. So when I turn on the A-light, by merely pushing the button slightly, not fully clicking the button, I can go from low to high. So there's low, medium, and high with the blue light. And here it is with the red light, low, medium, and high with the red light. That gives you a lot more clinical flexibility. The lasers only have one power level. It's either on or it's off. Now you'll notice on this white screen, we get a very nice looking large concentrated blue dot. And that's because the camera is very good at picking up blue wavelengths. Same with the blue laser. I get a very nice looking, very concentrated blue dot. But when you're not looking at it on a video, on a website, but when you instead look at it in real life, you'll find out that it's not as concentrated and not as bright. That simply has to do with the difference between the sensitivity of the camera sensor and your eyes. Your eyes aren't as good at picking up the blue wavelengths as the camera is. But rest assured, the blue light is there and it is working, even if it doesn't look as bright as the red light. So, we've covered the physics of the light sources. We talked about the difference between coherent LED light and coherent laser light and divergent LED light. Coming up next, we're going to talk about the clinical differences and how each type of light is applied in a clinical setting. We'll start with the lasers. Because laser light is coherent and it doesn't diverge, it tends to travel really far and really well. Therefore, if you treat an acupuncture point and you treat a local point, that light will tend to travel in the meridian through the entire meridian. It will move a lot of chi, it will have remote effects, even though it's treated just in a single local spot. Therefore, lasers are excellent for treating acupuncture points. Red light has a tonifying effect, blue light has a sedating effect, And you can use both at the same time if you want to on different points. You can use one or the other. When you keep these handy, you're covered for acupuncture points. You can use them for auricular points on the ear, use them for points on the body. They're excellent, they're painless, they're completely safe. People love them for that reason. Now when we talk about LED lights, these aren't going to have the remote effects. These are best for local effects. When you need tissue effects, deep tissue penetration, for example, local wound healing, skin surface issues, muscles, ligaments, tendons, if you're trying to affect something in the local area. And as I mentioned before, you have 3 power levels. Depending on how much power you need, you have low, medium, and high on the lights. Therefore, you can tailor the power level to exactly what you need, and you can use it for an extended period of time if necessary. Now, the blue light acts kind of like ice in a light. If you have an acute problem, if you have an acute injury, if you have inflammation in the area, then the blue light tends to calm that down very nicely. It's also excellent for skin issues. It's antibacterial, excellent for acne, eczema, rashes, skin surface issues, all respond well to the blue light. So between the red and the blue, you have an excellent way to treat local issues. And with the lasers, you have a concentrated way to affect the acupuncture meridians by treating acupuncture points. Both have great clinical results. Both are safe, non-heating of the tissue, non-harmful. You can't overdose on these things, and people just love them. We get excellent reports about how the patients respond. One other thing I'll note, the lasers are small enough that you can actually put them in your pocket like a pen. Whereas the lights, because they're slightly larger, although they do come with the clip, which is great for putting in a pocket, they also come with a holster, which means that they can actually be carried on the belt throughout your workday, make it easy to just have it handy, grab it, use it, and put it back. So there we have it, the difference between the lasers, the lights, all of them produce excellent light therapy, and all of them are going to give you great results. Let's talk about how to treat with your light. I'd like to start with just some general questions that I get asked and general usage. First of all, the thing to remember is that each light has 3 power levels. And to access the different power levels, once the light is turned on, you don't have to fully click the button each time, but just press it lightly and it goes from low to medium to high and back to low again. Here's how that looks coming through. You can see how it penetrates. There's low, there's medium, and there's high. In each one of those cases, you can use exactly the right amount of light that you need for the penetration you need. You can even, when you're treating a body part, you can treat from both sides. You could do some time from one side and some time from the other if you're trying to get into some place that's deep. Now, about the light that comes out. Some people ask if they need to use safety glasses when they're using the light. The answer is no. The light coming out of the light is safe, it's not harmful, but some people do find it uncomfortable to look at for a long period of time, particularly if it's on the high power setting. So you certainly can use the safety glasses, but they aren't mandatory. Should I touch the skin with the tip of the light while I'm treating? Well, the answer there is yes, you can if you'd like to. You can, for example, move it around on the skin if there's a larger area you want to treat, or you can just treat from a distance and keep it moving around that way too. You can keep it in one spot or you can move. And if you do choose to touch the skin and you decide that you need to clean the tip of your light, it can be sanitized with a disinfectant and a soft cloth. It is a pretty tough tip. It's made of acrylic. You're not going to damage it as long as you don't use something abrasive or something that is sharp that'll scratch it. How much time should I use the light? This is a good question that we get asked, and it really depends on what you're trying to treat. If, for example, you're trying to treat something that's a surface level on the skin surface, say you're using blue light on acne, you may only need to treat for a few seconds at each spot. If, however, you're trying to do deeper penetration, you may want to do a few minutes at each spot, and that's totally fine. You can't overdose on the light. You're not going to do any harm by using an extended period of time for treatment. Another technique I find useful is to move the body part during the light treatment. So I'll demonstrate how that works. Just setting the light in the area that I want to treat, and when there's a restriction or when there's a movement difficulty or pain, it's useful to have the patient Just gently move through a range of motion while you're providing the treatment. And as you continue to do so, you can focus, you can ask about feedback where the sore areas are and move the light as well as moving the body part. You'll find that you increase range of motion, increase circulation, and decrease pain. It is permissible also to use both colors of light in the same body area at the same time, or one after the other. So after doing the red light, I could immediately follow up with the blue light to reduce inflammation, for example.